Hello, everyone. I'm Liise-Anne Pirofski. I'm the chief of the Division of Infectious Diseases at Albert Einstein College of Medicine and Montefiore Medical Center. And I have the great honor of interviewing my colleague, friend, and faculty member, Theresa Madaline.
Thank you, Dr. Pirofski. I am the healthcare epidemiologist for Montefiore Health System, which means that I oversee things like infection control, hospital epidemiology, and our outbreak and pandemic response.
I think that what I'd like to start with, since we here in New York are potentially emerging from a really catastrophic series of months, is I'd like you to tell us a little bit about communication, which I would imagine is a really important part of your role, and how important it was in rolling out the strategies and policies that we implemented during the COVID-19 crisis.
Yeah, so thank you for asking that. I think that there are few things as important as communication as we've learned during this crisis. And I think I've learned personally a lot about communication, and as an organization, we've really evolved the way that we responded based on the needs of people and to try to enhance all of the methods of communication that we end up using. There's a number of outside entities that we need to communicate with, and a lot of my job is making sure that those lines of communication remain open, and that I then take that information and translate it into documents, policies, procedures, et cetera, both for the leadership of the hospital, but also for every person that works here. And so in this particular time, this is a challenge because those recommendations and communications were coming at lightning speed and changing very, very quickly, because this is a new virus and we're learning as we go about it. And so we were forced to sort of adapt to what was coming at us from places like the CDC, the Department of Health, et cetera. So one of the things that I learned really quickly is that you really can't rely on people to come to get information. It's much more effective if you push that information out at regular intervals. So I think the push versus pull is definitely a really important communication lesson. And part of that is that people get information in a lot of different ways, depending on their role and just the way that people like to receive information. And so in the beginning, sending an email and asking a bunch of people to disseminate information, while that may be effective for some people, it wasn't getting to everyone. It was really clear to me that that was not going to do it. And so we put a number of additional things in place to make sure that people could access the information that they needed. So things like having an intranet site that was completely dedicated to COVID-19 and all of the policies and the pathways, protocols, all in one place. Not only for people to see for the first time, but if they needed to reference it again later, it's all there and it gets continuously updated. So very helpful. Other things that I think were helpful were regular phone calls and then ultimately webinars, where on a weekly basis, I would update the institution and anybody who really wanted to tune in and listen or to watch the recorded webinar later about what were the things that CDC said this week? What did the FDA say this week? What did Department of Health say this week? What did we do at Montefiore that's different this week? What's happening in the literature? What can we learn from the science of this disease? And how are we changing here at Montefiore what we're doing based on that information in real time? And what are the things that you need to know as a person who works here in whatever role you have to protect yourself, to protect your patients, and for us to kind of get through this together. So I think that pushing of information outward and making it available at any time to anybody was really important for the health system.
Well, being someone who was a recipient of all of this knowledge and listening along the way, I can certainly assure you that it was really welcome and really effective. I'm wondering, though, whether for you as a communicator, there were other challenges. You needed to report from the field, as it were, to the C-suite, and it seems like what was being drawn out of you must have been a very sort of complex set of responsibilities in terms of communication. And I would imagine that the information that was communicated to different groups was different. Different groups had different needs.
No, that's a really good point. I definitely think different groups have different needs, and trying to tailor that information, it's very time consuming, but very important to make sure that whatever it is we're saying and doing really supports the practices in areas where things aren't always the same and in places where things aren't always the same.